So, welcome to the Cosmic Powerhouse. Today we have another episode of a Let's Create a Healing Temple show. And I want to welcome Frank Grossmann, our guest today, which will speak about the topic of rare diseases and all about this and more. But before we start, we want to ground ourselves, pay attention to what we want to build, the healing temple. So we take a deep breath first. And ground ourselves. And I want to create a safe space for all of you who are watching and listening to us in our shamanic technique. So that we have the right high vibrational energy in the room. Okay, Frank. So let me introduce you shortly. You are the founder and CEO of Orphan Healthcare, which is a Swiss-based NGO, a charitable-based organization, and it's caring all about rare diseases, and this worldwide. But you're also the founder of or startup creator of Orphan Biotech. This is linking to your background, right? Which is in the pharmaceutical area. And now we are really curious about, what does it mean, orphan healthcare? When I think about orphan, I think about orphanage and I think about kids. So what is it meant to be, and how is it linked to your personal story and your passion for being exactly in that area active?
Very good question, Manuela. Orphan healthcare is actually the word, and it prescribes exactly what we do. We do health and care for rare or orphan diseases. So they were neglected, and the US created the Orphan Drug Act in 1982. And they decided to push forward the innovation, research, and development of so-called orphan drugs, which means drugs for rare or orphan diseases. And this is what we do in orphan healthcare. And Orphan Biotech is a biotechnology-based startup, and there we develop drugs from natural resources and try to transform them into orphan drugs.
That is a very specific area, right? So, and especially in healthcare, we know that such special areas already have a lot of challenges financial wise to get the right support. So what is the passion behind that you started with that specific topic? So is there some personal link to that area?
Yes, Manuela, there's a personal link, a very strong one actually. When I was a kid, I faced a very super rare lymphoma cancer in kids. I was 12, diagnosed very late because nobody thought this could happen in a young kid. And miraculously, I survived. So that was the first gift in my life.
God.
And 4 years later, I was so-called healed, but actually my immune system was damaged due to the strong chemotherapy and radiation program I had to face. And I got the gift having a strong mama, and she supported me in any ways. And later on, I was able to study and become a medical specialist and also teaching pharmaceutical science at ETH in Zurich. And I learned how important it is to create impact in rare diseases or for rare diseases, raising awareness for them as well. But on the other hand, patients, especially kids mostly affected of rare diseases, they needed daily support, quality of life, and patients and their parents needed guidance. And this is what I faced and remembered when I was a kid, that my mother actually got lost in the treatment area because she didn't know anything about it. And So there were no internet at this time, and nowadays we have it, but parents are still struggling to find the way through information, healthcare, and the healing process, because most of the time there is no treatment available. In order to provide this, I created my own momentum, my second momentum in my life, when I used some money of my will, my grandma's will, and I saved some money, and I started this NGO, Orphan Healthcare, to be able to give back to kids and families affected by a rare disease.
Yeah, that's so wonderful. What a support and what a story. So, yeah, it sounds like that goes really far beyond the medical focus, right? So it's not only about the treatment and what is the right therapy. What you're telling us is so much more going into, into that field of spirituality. So all the non-physical. So how do you feel in that situation? How is the family impacted of that? So how do you incorporate that now with that knowledge from your personal experience as a child and also working in that area now for a long time? So how do you incorporate that spiritual being or techniques in that field?
It's a very important process to face that a disease is always part of the body. And even cancer is part of the body, since every day we face cancer cells in our body, but the body is able to detect them, the immune system, and destroy them and stay healthy. For me, cancer is a principle of a kind of disbalanced cell formatation. And since my immune system got destroyed after the 4 years of cancer treatment, I realized that my mind and body and soul was unbalanced. And I started with a psychotherapy session at the beginning, and later on I did a body-mind coaching healing session, that I learned to use my inner strength and my voice to be able to talk to myself. Like when I do my power yoga, this is how I face the breath, I face my body, and to find the balance we mostly lack of doing the daily business. And I found the way to increase my quality of life and my immune system by doing this regularly. So this is part of my spiritual and energetic principles of living, facing what we have, even also facing cancer or other diseases, accept them as a part of the system right now, and later on trying to change our mindset into a positive mindset. So I know even friends, they have super rare, very severe diseases like butterfly disease, epidermolysis bullosa, and one of my best friends, she's in pain every day, and she managed to trigger her pain level from, let's say, 10 every day with a positive mindset down to 1.5, 2. So without any medication, she's able to live with this situation and talk to her body and try to prevent from more harm of the pain harming her mindset. And so we can do it. This was my experience of transforming my mindset from a classical patient with cancer into a kind of more positive thinking patient of the future.
Wow, that is a very strong message, I would say. So if you're able to, in that situation where you have pain every day and also what you've experienced in your childhood. So if you're able to really reduce the pain level with your own abilities, right, to learn the techniques and to learn with your energy body and the whole system, the whole organism, that is really a strong message that there must be more than how we do it usually, right, to deal with disease and sickness. So how could this approach, so when you know that now and you come from the pharmaceutical area, and I wonder, how would you then see healthcare transforming in really accepting our spiritual nature much more and really implement that in the healthcare treatments and all the processes, so people can learn how to feel themselves and can actually perfectly support their healing process, because that is what we actually all should have as a goal, that we really support our self-healing power, right? What is your idea, or what is your current activity already on that?
Changing the system, the healthcare system, into a healthier system is a very wise but stepwise approach. Since we came from this area, right? Let's say 20,000 years ago, we had healers and they incorporated all the processes of healing. And even nowadays, we don't even know exactly what and how the process of healing is conducted. There is research going on about it, but I know people, they had cancer and miraculously they were healed after a while, even without chemo or radiation program. But this is super, super rare, but not exactly understood. So healing is a process of using modern techniques to diagnose a disease, using other modern techniques of conventional medicine to start the healing process, to support the body, but looking at as a holistic system, we have to talk about medication, modern medication, the doctor by itself, but also the patient. So at the end, it's the patient who is the most important component of the healing process. The doctor can conduct it and the medication can support it. So yeah. I would definitely look into a comprehensive approach and a holistic approach to talk about healing, that not only the drug by itself is the most important component, it's the patient who is willing to leave the passive situation behind it and says, okay, I'm happy and I'm willing to do so. So when I faced my cancer, there were no treatment available. And my mom talked to me while we were on vacation, and she said, Frank, listen, there's only a clinical trial. They didn't even call it this time a clinical trial because there were none. But there is a medication. We can try to use it to reduce the number of cancer cells in your body, but you have to be in. If you're not, we will not be able to run this medication trial. So it was my positive mindset that I decided in the age of 12, okay, there is no other treatment available. I have to go this way, but I do it with my whole mindset. I will be behind it, even when I struggled from the side effects. But this was a very important step forward.
So we see a lot of strengths in you. So when you decided that already with 12 years in that situation, wow. Yeah, actually, so as I'm a shaman and an old healer, so I can only agree, yes. So there's such a lot of wisdom in the world, in the cosmos. And actually, we can say we all know how it works better. Yeah, and there's energy and light that is important components. And besides the physical body, we have our energy body. That's what I did in the beginning of the session, right? To open the kocha, like we say in the South American shamanism. So it is really more our soul, our energy body, our bubble around. And there's, different information about how it looks like a disease will show up there as an imprint, and we can work with the energy body to actually release the blocked energy and change this. So that is sometimes the miracle behind that patients can be healed who have really very strong diagnosis, have cancer, and comes easily. And that's my personal experience also. I healed myself as well. So I'm really convinced of that. We can do that. So speaking about rare diseases, often they got unnoticed in the healthcare noise. So what are you doing then to really make people aware, to bring the focus on that area, and to really get the support for research and better treatment and a different way for the processes? So what is your strategy to bring the topic of rare disease more on the agenda of healthcare summits or discussions?
It's actually a very easy idea about it. Since I faced it and I know what is important about it. The first thing is that we know that it's a rare disease we are facing in our family or in ourselves. And my strategy is to be an advocate for rare diseases. So this is why I founded Orphan Healthcare as well. And rising awareness is very, very key in this area, since they were neglected for many, many decades. And talking about it, bridging knowledge, bringing people into interviews, and building a network and conducting this network of like-minded people, affected families, and also healthcare leaders in securing substantial and sustainable support for these affected. And the idea behind it is that as soon as we talk about it, the burden is less. And talking about to children is for me very important, since I was a child and nobody actually faced the truth and were able to tell me that the kid who was in the bed next to me in the hospital passed away over the weekend. So when I came back on Monday and I had to start the next session of treatment, this boy was gone, and I faced it and I felt it, but nobody was able and willing to talk to me. So I realized that talking to kids need the right approach and the right languages, and for those I created and I realized that talking to children needs the right language, and therefore I love comics. So I decided I start with a comic special like You and Me. And we also created hand-knitted finger puppets made in Bolivia from indigenous people in a circular economy project. And those help them to decrease the burden of being affected in trauma therapy sessions. And this approach is already gone international, since we reached out more than 60,000 families affected with this book in 3 languages. And even in certain countries like Malta, the government supported this project and supported the financing, that not only kids affected by a rare disease have this book available, and at home also kids in schools learn and now how to realize that the disease and the boy next door is affected, but it could be my best friend. And this is the process of being included, because if you work alone, if you run alone, if you try to heal alone, it's a very long and difficult pathway. But if you have friends, the burden is less, and they can support you, they can hug you. And this is all about healing as well. And kids, they don't want to be ill. I didn't want to be ill when I was a kid. I wanted to be similar. And this is also about friendship and being similar and having friends, and using the right language for kids as well as for parents, and giving interviews, being mentioned in articles, having a website, talking on conferences. This is all about raising awareness and knitting the net of community and partner.
Such a beautiful work, absolutely. Yeah. So because like we say, it's all about energy, which is so important, such a big influence on the healing process. And yeah, community is really very important for that, and being accepted and seen, and not to make something miraculous out of it, just to accept it and to live with it, and have people around you. And also for kids, so I learned that the kids up to 6-7 years, they are on the theta brainwave, so they are very open to receive, and it's so important what we say to them and what the experience is, right? And yeah, and they are very much aware what's happening around them. So like you say, when another kid is getting sick or even died, they would actually exactly know what's happening. So it's not very helpful to tell them a different story, but to just pick it up and deal with it. Yeah.
Yes, one of the strongest sentences I heard from a little boy when his sister passed away. He said, "The good thing is that now she's in heaven and flowers never die in heaven. So she will always have flowers around." And this was one of the most beautiful picture I faced when this boy talked about his sister who was already gone to heaven. And they really have a great picture and a great way to overcome the situation. And sometimes they're very simple, their messages.
I have goosebumps all over my body hearing that. So beautiful. Yeah, like you say. So how balancing vision with practice? So how do you deal with that? So you see the long-term vision, of course, of building your business and going forward, but also the needs the family have and the little patients. So how do you deal with that?
We guide, we support, and we counsel patients. Like we talk about the next step, their wishes, and their focus, and alongside we decide what we can help, where we can help, and not always patients or parents are able to focus this one. But we guide them to try to ease in the burden, to bring knowledge, to bring the network, and also helping them being conducted sometimes in a clinical trial, because this is one of the big wishes that my kid gets healed. We find a medication for it, and it stays as a wish. But sometimes we also have to face that there is no healing available at the moment, and that they can learn how to live with the circumstances of facing also the death, and living and death, or being born and death. There are two balanced systems on the planet. This always happens, and we don't face it when we give birth to a child. So we want to have this child happily grown out of our family and helping us when we are turning older, but also working in this field with coaches, patient-centered coaching. It helps the patients. It helps also the whole family, even the shadow kids in the back, that they face that death is part of life. And so we have the short approach, and we also have the long-term approach, where we try to look forward to help them in their way of making their own journey, because we can't do it for them. They have to decide where they're going to go and where they want to be. But helping them, guiding them, this is what we created as an impact and solutions at Orphan Healthcare. Not only with the story, but also with proactive support in clinical trial support if this is needed and wanted.
Yeah, what a valuable support you're giving. That is really beautiful. Yes, so Living and Dying, there's a famous Tibetan book I was also reading when my father was in the dying process, and I was learning about how can I support best and how can I dive deeper in that. And yeah, exactly what you're saying. So our society is not so much used to speak about death and how to deal with it. So people are often putting the sick people in one corner, one box, so more, yeah, separating themselves from that. And it's exactly the different thing is needed, right? They need to be accepted, and to talk about is such also an energy release. So also here we are working with energy and alchemizing things, so bringing higher vibration into the whole thing. So that's really very beautiful what you're doing. It sounds very comprehensive what you're doing, and it's very much about support. What about emerging technologies? So we are talking a lot about AI. So I can imagine, especially in this sector, I think you said it in the beginning, it is also included to see this maybe revolutionizing the treatments. So what role does it play currently and in future?
Yeah, let me start from the perspective of knowledge. Knowledge is not worth at all if you don't share it. So we have to use knowledge, we have to share knowledge, and doing it by ourselves takes time. It's a long road, but the new technology of advanced artificial intelligence can speed up this knowledge transfer. And I'm really looking forward into more technologies that they are able to generate early diagnostics for children, because this is one of the missing links. Patients are waiting too long to get the diagnosis, and even putting symptoms together for medical practitioners, AI can support them very well, and this is already underway. And I wish we can use more of this technique to be more precise, to be faster, in order to have the diagnosis done easily. Even newborn genetics and testing is one of the big goals, but you can't test all 7,000 rare diseases on a newborn. But technology will help symptoms, contact symptoms and put them in the right way. And even our new book will have this included, that parents are able to use one code in order to find their patient organization, specialized clinics, doctors, and center. So technology is very important for me in this way, and we can even create databases on, and this is what we're working on with a partner right now, creating databases where the patient is in the driver's seat. And this is for me very, very important, that the patient-centered approach takes a step forward, since rare diseases can be looked at as a little revolution of medicine, because patients sometimes are the specialists of their own rare disease. And I heard many specialists talking to me, medical practitioners, professors, and others, and they said sometimes there is a mommy, she knows already more about this disease than I do. So having those mummies, creating more impact on the technology and medicine side, and conducting those information can help getting faster diagnosis and getting faster into a treatment option.
Okay, so do you think that the current WHO plan, so where it's also about patient safety, so this action plan, would help in that? So because I read about the strategic goals, and there's very much mentioned that the patients should be included in all of the processes. So they, like you say, they are very often the best expert in that kind of area, and can help with their information, how they feel, what they are observing, just to be part of the team. What do you think about that?
I don't know so much about the top-down approach from WHO, but I believe that the patient by itself is one of the key factors in this approach. So the perspective from the patient side, from the if we put ourselves into the seat of a patient, then we face what is important for a patient. And conducting it from the top-down approach is sometimes the approach I've seen 15 years ago, and it never was really successful. But implementing the patient into the conductor of his own health, of his own data, can definitely speed up the technology and healthcare. I don't believe into a top-down approach that some governmental body says this is what we need, this is what we have to do. If the patient is forgotten or got forgotten.
Absolutely, because it should be about the patient, right? So patient-centered medicine should focus on the patient, and yeah, here we are back with the
Yes.
patient, what brings in also the spiritual nature. So how would you empower patients to be able to play that role? So because we also hear about patients are maybe a bit critical with sharing data or too much technology and so on. So how could you see the role of the patient in future, or how to support them, to empower them?
Building trust is the first step. Most of the time, patients are not patients before they are sick. Patients face the situation when they become sick or when their kid is sick. Empowering patient for us means building the basis of trust, educating them, guiding them, and helping them to make their own decision based on a valuable treatment, or even if they want to say no, which is their right as well, I believe, that they say, I don't want to go this way. Maybe I want to try an alternative pathway, but I'm responsible for my decision. And this is one of the key factors, that not the doctor is the decision maker. The patient should be the decision maker of the next step of treatment. But misunderstanding is one of the key factors in medicine, because the doctor says A and the patient doesn't even understand it, what they mean. So we have to translate this information into a guided understanding of a patient, that they feel enabled, and this is the process.
So translation, communication in general, I would say, is a big topic in all areas, but especially also in healthcare. And what do you think about the heart connection? Because when I'm a medical person and I'm with a patient and I'm in a high vibration, so when you're talking about trust, I can imagine that kind of energy field has really an impact. So I can have a much better situation already, right?
Yes, and this is true, but I faced many times that if you get diagnosed with a kid with a super rare disease, and you have to find all the information on your own, by your own, you get lost in this area, and you see that no one is really guiding you, no one is supporting you, and you feel neglected. And finding the pathway back into a healing process means, at first you have to talk to someone where you can trust. And I figured out that if a mommy talks to another mommy, this is the best way of building trust, because there can be 10 professors in a white coat standing in front of her and telling her what to do. She will mostly trust the mom next to her if they say, we did it, we trusted in this treatment, we were trying A, B, C. This is the trusted guidance, and this is how we also support patients in special camps, where we invite strong parents and other parents, and they build the basis of trust. So it's the key fundamental of healing.
Okay, so I hear you saying, though, about peer groups, that the people which are affected by the same situation, that you bring them together is really a milestone in all of that. Right.
Exactly. And even suffering on different rare diseases doesn't mean that they don't talk and they don't understand what's going on, because I realized that we had this several times happen, that a mommy is sitting with another mommy on our camps, and she saw how difficult the other kid was, but the mommy and the kid were happier and more relaxed. And she realized, oh my God, I thought I'm alone on this planet with my boy or girl but I'm not alone anymore. First, second, the other situation, the other family facing a much more difficult healthcare situation, and they're so more relaxed, and this triggers and supports their resilience. And this is where we want to guide the parents to, and the kids to create more quality of life and also reaching a better level of resilience.
Yeah, so supporting such communities like you do it in your NGO and all your support services, that would be a very good way to support the patients and the families to really be more able, better able to deal with the situation and to bring healing forward, right?
Exactly, yes.
Okay. Yeah, so let's have 3 short closing questions. So what be your call to action for change, when it could be a specific message to our audience and the healthcare system?
Put yourself, even as a specialist, into the driver's seat of a patient and talk the language that will be understood.
Okay. And second, what are you doing to maintain your energy to stay healthy? What is your principles or recipe?
My personal recipe is eating healthy. I barely eat fast food or prefabricated stuff. I love cooking. I eat very healthy. I do a lot of sport, balanced sport, not heavy things, but I go regularly on my sport program, and I love to do my sport program. And I also do my power yoga, where I really get into my body and mind. And this helps me to be balanced every day, since I'm sometimes have a very stressful life. I have to travel. I have to attend conferences. I'm talking to partner, so this takes a lot of energy. But and in this way, I keep definitely balanced.
Okay, very good. And last question. So about legacy and hope. So how would you like to have your contributions to be remembered in future?
In a very good way, I would say, in a colorful way, with the sentence on top: he never gave up.
Thank you so much, Frank Grossmann. Wonderful insights in the area of rare disease and your personal stories. Thank you so much for all your contributions and support for the kids and the families. And nearly to tears talking about that. So it was very emotional for me as well. Thank you.
You're welcome, Manuela.
So let me take my energy bags. So thank you, dear audience of the Cosmic Powerhouse, and Let's Create Healing Temple. So I hope you could take a lot of good information and insights for your journey through healthcare. And yeah, let's change healthcare to a better way, to a better future, and let's create a healing temple together. Thank you.